Number one, I feel like the genetic counseling has come a long way. And number two, the surgeries have come a long way. So the prophylactic surgeries now, you can do mastectomies and reconstruction and have scars that don't show at all. You know, I then opted for that surgery, and I went to a very particular surgeon in Texas, who I highly recommend, Dr. Minas Chrysopoulou, who made it so that, you know, I look completely normal and you can't even tell that I've had these surgeries. Well, I wasn't willing to do that when I first tested, because that wasn't the way the surgery went. It still isn't for the most part. The notion of 3 surgeries with expanders and scars that showed, I didn't want any of that. I couldn't do it. I didn't want to do a hysterectomy at age 33 when I was single and straight. But now you can do it robotically. You can have these tiny little scars. Things have come a long way. And you asked me another question. What was your next question about that? The community and the outreach and what I've learned. So I really feel like the promise of a site like Fight Cancer Global is that we can share information. We need that. Best practices for patients to share information, for us to share research, even best practices for how you do when you're going through chemo so you can feel really well. I learned that from looking online and reading, you know, other patients' experiences of what they were doing. So Fight Cancer Global has a huge potential to make life better for patients and for doctors, and to share resources, you know, to share cutting edge information. I think that that's really key. Educating friends and family and support group members for how to respect the decision of the patient. Once a patient has made up her mind or his mind and said, I'm doing conventional, or I'm stopping treatment now, I can't handle it anymore, I choose to die. Whatever the patient's choice is, once they've made that choice with discernment, I believe that people need help in supporting the patient. And there isn't support right now for family members. There isn't support in teaching friends and family and colleagues how to respect patients' choices. So it's a fine line, right? I have a friend right now who's very sick, and she's saying, please, people, stop sending me articles right now. I'm in hospice care. Just please honor my decision. And people aren't doing it. Even people who have been my teachers and who I respect. And I find that so painful because I've been in that situation. So a site like Fight Cancer Global can help with that too. If you can teach friends and family members how to respect the choices of the patient.